Western Mass News is tracking the actions many communities in Hampden County one day after the state elevates the risk level for EEE virus. Good evening, I'm Beth Ward. The high risk now in several cities and towns, including Springfield, East Longmeadow, Agawam, and Westside, after a Hampden County woman tested positive for the illness. Evening sporting events are being moved, and health officials are asking people to wear bug spray and avoid outdoor activity at dawn and dusk. Western Mass News reporter Audrey Russo is getting answers from an infectious disease doctor about EEE. She is live in West Springfield with the latest.
In West Springfield, one of the many communities that has had their risk for EEE elevated. You can see behind me on Clark Field, there's a football game that had their time moved up today so that student athletes, their family and friends can clear out of the field by dusk, which is when health officials say mosquitoes start to become more active. Now, there is no cure for EEE, and it might be a little bit of a concerning factor to some families that the only ways to keep yourself safe are preventative measures. Well, I spoke with an infectious disease doctor who tells me a little bit more about why EEE is so difficult to study and mysterious. Have you ever seen cases of EEE in your experience, either in training or here?
Yes.
Megan Gallagher is an infectious disease physician at Bay State. She tells Western Mass News EEE is a difficult disease for researchers to track.
Because it's not well studied and there isn't a good test for it, we don't actually know what percentage of people who get it develop severe disease versus what percentage have no or only mild symptoms.
She says EEE's cyclical nature means it's hard to study and compare active virus years like this one to years in between spikes.
There have been years in which there's only 0 cases in the United States. And so even in high prevalence years, the numbers still are not very high. And so it's difficult to study a disease that does not occur every single year.
Gallagher says that's partially why the best practices, wearing bug spray, long sleeves, avoiding dusk till dawn, are so general and preventative rather than reactionary. When she does have a suspected case, she says there's a checklist she must consult.
You do a history, a physical. Generally speaking, in almost every case where you're suspecting it, you would do a lumbar puncture to assess what the spinal fluid looks like.
If lab tests come back with a EEE positive, it must be reported to the state. When questioning the patient, Gallagher says it's important to get a sense if a symptom could be linked to mosquito exposure.
Trying to get a sense are you outdoors in a location where you might be exposed to mosquitoes, particularly if it's at a time of day where mosquito activity is the highest. That is more helpful to me.
Again, health officials are cautioning people to wear bug spray, avoid being outside between dusk and dawn. Western Mass News will continue to keep you updated with the latest information as to the risk level changes in each community. And again, school districts like West Springfield out here are working even into next week to reschedule their games and their practices to avoid those dangerous times outside. Reporting live in West Springfield, Audrey Russo for Western Mass News.